Hey guys, it's Mo. This is day two, part two. I will be doing the doctors, and then I will separate Andrea Bowling, the step, or not the step, the foster mother, just because that is going to be some really emotional, really tough testimony. She is really the only parent that this precious little baby had that really loved him and showed him any tender care, and she grieves on stand like any mother would. So I am going to separate that into its own video. I'm also going to separate the medical examiners into its own video because I know those 2 testimonies will probably be super hard to listen to for some people, and I want you to take your mental health and, what will you will tolerate. I know this is a tough case. I picked it out because you have 2 defendants, one basically claiming that she did all the bad things and her husband didn't know anything, and I really like this case, and we'll get to it in a live stream because the female prosecutor, Prosecutor Madonna, as we call her, she really goes after the mom in a way that I think is satisfying for all of us who really want to go after this mother, this terrible, awful mother, and our breeder or incubator at this point. But I understand that those are going to be super hard testimonies, and no shame, no guilt. If you cannot watch them, that is totally okay. I would rather not get views than have you put yourself through something that's really going to affect you and make you have a really bad day. So, no shame in that. But let us get the overlay on so we don't have to see Law and Crime. Little, little Fry, when I thought he was going to be a Pomsky, a real one. And we are here.
We're back for the afternoon session of testimony in State of Ohio versus Daniel Groves, State of Ohio versus Jessica Groves, case number 19 CR 586A and B. Counsel and the parties and the jurors are present in the courtroom. Is the state ready to proceed?
Yes, Your Honor.
Is the defense ready to proceed?
We are, Your Honor. Thank you.
Yes, Your Honor.
State may call their next witness.
Your Honor, the state would call Dr. Muhammad Ali.
Muhammad Ali? Okay. Also, blessed be the captions, for they bring hilarity.
Doctor, can you raise your right hand for me, please? Sir, do you solemnly swear the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God? Please have a seat. Sir, there is media in the courtroom. Do you have any objection if they film or photograph your image during your testimony? No objection. You may proceed, Ms. Sessions.
Thank you, Your Honor. Sir, if you wouldn't mind, introduce yourself to the jury and then spell your name for the record.
Yeah, I'm Dr. Muhammad Ali, and it's Mohammad, and last name is Ali, Ali.
Wait 1 second while I write that down on the clicker, because the banner. Although you would think I'm just gonna call him Dr. Ali. Add banner. Oh. Sorry, guys. It is a Monday, and I'm not as on top of it as I usually am. I know your shock and absolute, you know, just you just can't imagine. You had no idea that that I was a hot mess most Mondays.
I'm a pediatrician.
Okay. And where are you currently working as a pediatrician?
Except he looks like Salvador Dali. Okay.
I work for CAC of Pike County up in Waverly.
Okay. How long have you been a pediatrician?
Actually, 20 years now.
20 years. If you would explain to the members of the jury your educational background.
Yeah, so I did my medical school from Peshawar University in Pakistan, and then I did my pediatric residency, University of Oklahoma, Tulsa.
Okay. And what are your current licensures or board certifications?
Yeah, I'm a board certified pediatrician, and I'm licensed in the state of Ohio.
Okay. And in your practice in Waverly, do you treat pediatric patients on a day-to-day basis?
Yes, I do.
Okay. What is considered a pediatric patient?
So pediatric, from the time they're born till they almost graduate from high school. It depends on what definition you look at. If you look at the American Academy of Pediatrics, it's 21.
Okay. So birth to 21?
Yes.
Okay.
Wow,
So you've been seeing children birth?
we are really stretching this kidult period. You know, remember when people were 18 and you just started living life, but now it's like 21 or 26 and you kind of launch out at 30. I get there's economic reasons and everything else, but this kidulta period is just lengthening the runway a little bit more each and every year.
Birth to 21 for 20 years.
20 years, yes.
Okay. At this time, Your Honor, I'd ask that he be designated an expert in pediatric care.
Is either definitive question the doctor, he said his qualifications is pediatrics.
I would waive such questioning. We would stipulate his expertise as a pediatrician based on his years of practice in his education.
Since his weight and stipulated, Dr. Ali is deemed an expert in the field of pediatrics. Means, ladies and gentlemen of the jury, he is allowed to give opinion testimony in his field.
Good.
May I continue, Your Honor?
Continue.
Thank you. Doctor, in the normal course of your business there at Valley View, do you maintain patient records?
Yes, we do,
Okay, for each patient
for each patient,
and each visit?
each visit.
Okay, let me hand you what's previously been marked as States Exhibit 19 and ask you if you recognize these documents.
Oh, is she wearing sparkly red heels? I'm not jealous at all. Just a little bit.
Do you recognize those records?
Yes, I do.
Okay, and how do you recognize them?
This is when I'd seen the infant in my office. I'd seen him there for a couple of times, different times, and this is one of the notes.
Okay, and when you say the infant, are you referring to infant Dylan Groves?
Yes,
Okay. Let me direct your attention to that time frame. It looks like you would have started seeing baby Dylan at the hospital. Is that right?
yes, I did. So the first time I'd seen him was at the hospital after he was born. And then once he went home, I'd seen him a couple of times at my office.
Okay. Were there any concerns for the baby at the time you saw him at the hospital?
Yes,
Medical concerns?
yes. So we had to keep the baby a little longer than usual. Normally, we keep the baby for a couple of days, but Dylan had to stay there almost a week because he was experiencing some withdrawal symptoms.
When you say withdrawal symptoms, what do you mean?
What that means is sometimes babies, when the mom is pregnant, it depends on what medications they're taking or what drugs they're exposed to, and the baby gets exposed to the same. And then after the birth, they can experience withdrawal symptoms.
Okay. Would you explain to the members of the
Just gross. Look, addiction is a hard monster to battle. And I try and I am working on giving people more grace, but this frosts my flakes, this burns my biscuits because like I always say, you know, when you have a child, when you get pregnant, when you have a child and you are going to, you know, you decide to become a parent, you are no longer just living for you. That's my opinion. Again, everyone has one along with, you know, a nose and a butthole. So feel free to disagree with me.
members of the jury what types of symptoms you look for?
So typically we look for a lot of sneezing, sometimes excessive diarrhea, tremors. The major symptom is tremors, shakiness, and then excessive irritability, lack of appetite. So there's a long list of symptoms.
Okay. Would a baby who's withdrawing from drugs experience pain?
That is hard to say, but you know, if you've treated everything else, all the other symptoms, and the baby's still irritable excessively, then that could be one possibility.
Okay. And you said you
Just
saw baby Dylan after his release from the
Ugh.
hospital as well, is that right?
That's right.
Okay. Would that have been January 16th, his first visit with you?
Correct.
Okay. If you would explain to the members of the jury what the reason for his appointment was.
So basically, once they go home, the babies, normally we see them in a couple of days. That's a routine. But especially in a case like this, you know, we want to make sure we see them because we want to make sure that after they've been treated for their withdrawal symptoms, you know, they're doing better and they're not reverting back to the symptoms. So with him, that was a major reason.
And do you call these visits well child checks or well newborn checks?
Yes, well newborn check.
Okay. If you would generally describe for the jury what that involves, a well newborn check.
So at this stage, when we see a newborn, what it entails is we want to make sure they're
as if I was on the jury, I'd be like, can I be excused for this explanation? I've had 6 children. I kind of know what they do. I mean, and I want you guys to keep in mind that these early appointments, these couple days after the hospital, couple and up to 2 weeks, about 14 days. He went to these appointments because he was with his foster mother, who actually gave 2 poops in a handbasket about how this little boy was doing, how this precious child was dealing with things that, he had no choice over.
Getting enough nutrition, we keep track of their weight, and then, obviously, their output as far as urine, and, how they're, in general, how they're doing, their well-being.
Okay.
You 2 can go directly to Snake
Do you
Island.
recall, or could you refer to your records and tell the jury who accompanied the baby to his first appointment?
Yeah, so the first time I'd seen the baby was a foster parent.
Okay. And were there any concerns voiced by the foster parent in regards to baby Dylan's health? Your Honor, these are medical diagnoses.
Council approach from record.
I really do like this judge
Restate
that
the question, please.
he takes time to answer things and think
Doctor, in your
about
well
them.
visit with baby Dylan and the foster mother on January 16th, did she express any concerns to you regarding his medical health?
Yeah, a couple of things. She had mentioned that he had been sneezing excessively and that had seen a few tremors.
Okay. Before we go any further, is it normal for a baby to sneeze?
Yes, it's normal for a baby to sneeze, but it's excessive sneezing, especially with such a background and a history, that it means a little different
Okay, and then also with the tremors?
with the tremors, yes.
Okay.
Although tremors are, very unusual in a healthy newborn. So at any point, if there are tremors, then we get concerned.
Okay. If you would explain to the members of the jury, if you remember, or by referring to the medical records, what baby Dylan's height and weight was at that visit on January 16th.
Yes, I can.
Oh, don't lick your finger. Come on now.
So yeah, he was 19 inches tall and weighed 5 pounds and 5.5 ounces.
Okay. If that were a little less than what he weighed at birth, would that be abnormal?
His birth weight was 5 pounds and 10 ounces. No, that's not unusual. So basically, by the time infants are 2 weeks old, if they weigh as much as the birth weight, then it's fine. They can lose up to 5 to 10% the first week or 10 days.
Okay, why is that?
A lot of times it's the retained fluid that they have in their body when they're inside mom, so they lose a lot of that fluid. And, that's an important factor.
Okay, and if you would explain to the members of the jury your general examination of baby Dylan, what that included and what you found.
So yeah, the general exam, we do a basically head to toe exam. We check all the systems, head and neck, chest, heart, abdomen, skin, neurology, all the different symptoms. And basically that day, his exam, there was nothing unusual about his exam when I seen him in the office at the time I'd seen him
Okay,
at that specific time.
no bruising to the baby?
I did not see any bruising, no.
Okay, were you made aware of any injuries as a result of the actual delivery?
Not that I can recall.
Okay, and it looks like you examined extremities, and chest and back, abdomen, nothing abnormal there either?
No, nothing abnormal.
Okay, and so would it be fair to say that other than the withdrawal symptoms, he was doing well?
He was doing well, yes.
Okay. And it looks like, let me direct your attention to January 23rd, 2019. Did you have an occasion to see baby Dylan again in your office?
Yes, I did.
Okay. And again, who was present for this appointment with the baby?
A foster parent.
Okay. And the foster parent that presented the baby for the
Yes, she managed to go to all the appointments that she was given to make sure this little boy was fine. The parents, not so much, as you will find out.
appointment, did she express any concerns in regards to his health?
Let me look at my notes here. Yeah, the foster parent had mentioned that, the baby had been excessively sweating, but did not report anything else like fever, rash, any illnesses, nothing else.
Okay. Would the excessive sweating be related to withdrawal symptoms, or is that something unrelated?
That's something unrelated.
Okay. And if you would again tell the members of the jury what his height and weight was at that appointment?
At that appointment, his height was 19.5 inches and weight was almost 6 pounds.
Okay, so he's picking weight back up.
Yes,
All right. And so would it be a fair statement to say at that appointment, the baby was doing well?
yes.
Okay. Was there ever any concern about an abnormal newborn screen for baby Dylan?
Yes, so normally we do a newborn screening on all the babies. It's required by the state of Ohio. And at one point, I was notified about an abnormal screening.
Okay, and
on
was
this
that,
baby.
I'm sorry.
But there was a little miscommunication because then after this visit, I never seen the baby. They transferred care to Christ Care Pediatrics. And then they had notified us about the abnormal screening. And we had thought that we had repeated. Normally, when we get an abnormal screen, the routine is we repeat it. And most of the times, the repeat ones come back normal. So for some reason, we thought we had repeated the screening, but we had actually not. There was a miscommunication.
Okay, and was that the
Oh.
17 hydroxyprogesterone?
Yes,
Am I saying that right?
you were saying that perfect.
Okay, would you explain to the jury what that is?
That is a product. So on top of the kidneys, we have a small gland. It's called the adrenal gland. It makes that chemical. And it regulates your blood pressure, your blood volume. Basically, it's a very critical chemical as far as especially your blood pressure regulation.
Okay, and so if the baby in fact had an abnormal 17 hydroxyprogesterone, if that was actually an issue for the baby, it would cause blood pressure
It
issues,
will
did you
cause
say?
excessive hypertension, and it depends on, how, because when you see the abnormalities in that gland, the adrenal gland, it can be to the point where the baby's not even thriving, the baby's not gaining weight, or the baby refuses to eat,
Oh,
So those are some of the symptoms. Routinely, we don't check blood pressures on babies when they come to the office, unless there's a suspicion for something.
Okay,
So that's why you don't see the blood pressure and the vital signs.
and was your office ever notified about whether or not a follow-up was done?
We just had we had some communication from Christ Care Pediatrics, and that's the last we heard about the screening.
Okay, so you're not aware of whether or not they eliminated that
Yes,
possibility?
I'm not aware.
Okay. If he had an issue with that, would that result in fractures to his bones?
No.
Would that result
Hmm.
in bruising to his body?
No,
Would that result in swelling to his head?
no,
Okay, so it's not an issue like that?
no.
I have nothing further at this time.
Ms. Hutchinson, Stratton, you may cross-examine. Questions?
Hmm.
Ms. Scott, you may cross-examine the witness.
Dr. Ali, when you had the exam with baby Dylan at the hospital, was that at SOMC,
Correct.
Southern High Medical Center?
Yes.
And was that at the same time that that was his initial birth before he was originally discharged? Is that correct?
Yes.
Okay. Were the parents present for your initial examination of baby Dylan?
The best that I can recall, I
no,
think when I
probably
did my initial
not.
exam, because the routine is when we do an initial exam, we go talk to the parents. So from what I can recall, I think I remember talking to the mother, just to, because routinely we discuss the newborn exam, and then if they have any concerns, questions, or they would like to discuss anything.
But your only recollection at this time, and I know it's been almost a year ago, your only recollection is you may have had a conversation with the mom?
I may have.
Okay. You don't recall having a conversation or dad being present for that conversation?
No, I do not recall that.
But it doesn't mean he was not present.
Correct.
You just don't have any independent recollection.
That's correct.
And then the 2 visits that you had in your office, those were, the child was accompanied by his foster parent,
That's correct.
and neither parent was present during those office
That is
visits.
correct.
Okay, is that unusual that just a foster parent brings in a child when a child is in foster care versus a foster parent and/or the parent?
So that's a good question. A lot of times when we see these babies that are, because of the social situation, they get transferred to foster parents or relatives. A lot of times when they come see me in the office, just the foster parent is there. Sometimes, you can have the relatives there, and then in cases I've seen the parents there too.
Okay, but it's more typical that the foster parent would
Usually
be
it's the
there along
foster
with the
parent.
child.
Yeah, yes.
Okay.
I like
Thank you very
this
much. Appreciate it,
doctor.
Dr.
He's
Ali.
very chill.
No questions, thank you.
Hutchinson, any redirect?
No, Your Honor.
Any other questions for this witness?
None on my behalf, Your Honor, thank you.
Is he excused?
Excused.
Yes, sir.
Yes, Your Honor.
Sir, thank you very much. You're free to go. State can call their next witness.
Okay, let me get,
The state would call Dr.
Touch. He's got an exhibit with him.
Oh.
He's got a paper with him.
With the red sticker on it.
blessed be the closed captions.
Sorry, who's your next witness?
Dr. Gregory Hudson.
Dr. Hudson. Sir, can you raise your right hand for me, please? You solemnly swear the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God. Sir, please have a seat. Now, sir, we do have media in the courtroom this afternoon. Do you have any objection if your image is filmed or photographed during your testimony? No objection? No objection. Ms. Hutchinson, you may inquire.
Thank you, Your Honor. Sir, if you wouldn't mind, introduce yourself to the jury and spell your last name for our record.
Okay. I'm Greg Hudson. I am a pediatrician. My last name is spelled Hudson
And Dr. Hudson, where are you employed as a pediatrician?
at Christ Care.
I call objection. This man is a football and or track coach or lacrosse, depending on where you are. I'm going to go with lacrosse. This man is a lacrosse coach. Just kidding. Back to
Christ
the
Care
trial.
Pediatrics in South Shore, Kentucky.
Okay. And how long have you been a pediatrician?
30 years.
Okay. If you would explain to the members of the jury what your
Silver fox warning. I'm just saying. Back to serialness.
educational background is.
Yes, I went to college at Murray State University and had a big degree in biology and a minor in chemistry. Then went to the University of Louisville School of Medicine, followed by a pediatric residency at Louisville Affiliated Hospitals and Kosar Children's Hospital, which is now Norton's Children's Hospital in Louisville, Kentucky.
And what licensures or board certifications do you hold?
I am board certified in pediatrics and have a license to practice medicine both in the state of Ohio and the state of Kentucky.
Let me hand you what's going to be marked as State's Exhibit 20. The record will reflect that I'm showing that.
The captions. I can't.
Do you recognize the document that I just handed you?
Yes,
Okay, and what is that?
that is my curriculum vitae.
Okay, and is that a true and accurate representation of your educational background, your experience, or licenses?
It is.
Okay. For the record, doctor, what is considered a pediatric patient?
Pediatric patient is a patient anywhere from birth up until 18 years or sometimes even through college age as far as the care that we give at our office.
Okay, and so you've been treating children from birth to
Through college age.
college age
sometimes,
for 30 years?
30 years.
Okay. Your Honor, at this time, I would ask that the court designate him as an expert in pediatric care.
It is offered Dr. Hudson is an expert in the field of pediatric care. Does either defense counsel wish to question him as to his extent of his qualifications?
Your Honor, we would waive such questioning. We would stipulate his designation as an expert in pediatric care.
Given the stipulation, court will find Dr. Hudson is an expert in the field of pediatric care, which means, once again, for ladies.
I love her highlights. I know we're not supposed to pay attention to stuff like that, but I do.
May continue, Ms. Hutchinson.
Thank you, Your Honor. Doctor, before we move on to why we're here today, in your course of business over there at Christ Care, do you maintain patient records?
Yes,
Okay, and are those maintained on every patient for every visit?
yes.
Okay, let me hand you what's going to be marked as State's Exhibit 21 for identification. Doctor, if you would take a look through State's Exhibit 21 and tell me if you recognize this document.
Oh, they're both licking their hands. You guys are, come on now.
Yes, I recognize his.
Okay, and what patient records do you have there that you recognize?
Patient records of Dylan Groves.
Okay, and is he given a patient number or some type of identification for the record? More than his name, or is you just chart them by name?
For the record, on the record, run the record back.
I go by the name. I mean, I think we do have a number that we assigned.
Okay, all right. Would you say that's a true and accurate representation of the records provided by your office to our office?
Yes,
Let me direct your attention to February 2019. Did you have an opportunity to treat baby Dylan Groves as a pediatric patient?
on February, yes, in February, yes. Mhm.
Okay, what was the first date that you would have seen baby Dylan? Would that have been February 21st?
February the 7th.
February, okay, February the 7th. If you would explain to the members of the jury how you became involved in baby Dylan's care.
Pardon me, I'm sorry.
If you would explain to the jury how you became involved in his care on February 7th.
Okay. Of course, the parents had scheduled an appointment. We had called, I do believe, because of an abnormal newborn screening that all infants get a blood test done shortly after the time of birth to screen for certain metabolic or endocrine abnormalities, things like cystic fibrosis or congenital adrenal hyperplasia, things like this. And there's a series of panel tests, and one of his tests came back abnormal. And so we contacted them because I think they had probably listed us as being the pediatrician.
He is totally a soccer coach, y'all. I am throwing it out there. I am putting it out there and or football. I mean, allegedly.
In the hospital. So we contacted them about coming in for an appointment, I think is what happened.
Okay. What was the reason, you said that you think that he came in because of some contact your office had with him, that you had been listed as the pediatrician at the time?
Yes, whenever a baby is born, the parents are asked who they want the pediatrician to be, or who they want the physician to be to take care of the baby. And that is recorded in the state registry, I guess. And so whenever the results of the newborn screening comes back, they make sure they send it to the address that's associated with that physician.
Okay. And so when you saw the baby on February 7th, would you explain to the members of the jury what took place during his appointment, what your exam involved and what you found?
Yes, he came in with both his mother and father, and there's nothing real.
Sir, he came in with his incubator and his incubator's enabler. We do not give honorifics to big old piles of duty, okay?
Out of the ordinary as far as exam. What they do, they come in and get a set of vital signs, get the weight, and then their nurse asks some questions about how they're feeding and, you know, if they have any concerns or problems, and then they're placed in a room. And I come in, I talk to them, ask them kind of similar questions and make sure everything's going okay, and do a physical exam, just ask about feeding and that sort of thing, and dirty diapers and wet diapers and how they're sleeping. The only thing that was out of the ordinary that I recall from this visit was that he had this abnormal screening test. And so I talked to them about that and asked them to go over to Southern Ohio Medical Center to have some lab work done to make sure that even though the test had come back with an elevated level for the state lab, that he was in fact normal. And so that was it. We had prayer, and then they left and went apparently to the hospital and had the lab work done.
Okay. Did the parents report whether baby Dylan was bottle or breastfed?
Yes, they would have. It would be here in the note. I don't recall. I think bottle fed, but I can look and see.
Okay.
Formula fed, Gerber soup.
Okay. And if you would tell the members of the jury what his height and weight was at that time.
Okay. His weight was 7 pounds and 2 ounces, and his length was 19.5 inches.
And then you said you do a general examination. Does that mean you do, part of that is a musculoskeletal examination?
Yes.
Okay. So what do you do when you do that part of the examination? If you would explain that to the jury.
So, we start with just looking generally at the baby's skin, make sure the color is normal. There's not too much jaundice, that they're not, that they're pink, they're not cyanotic. Then, you go from the head down, make sure that there's nothing abnormal about the head, ears, eyes, throat. Make sure the baby is moving the arms well and has something called a Moreau reflex, so that you can kind of pull up on the little baby's hands and just gently kind of let them go and startle, make sure they have symmetric movement of the arms, check the legs, make sure that the tone is good in the legs, the muscles are good. We check the hips by we call abducting the hips. We hold the knees flexed and then go out with the hips and make sure that the hips are not dislocatable. And then just kind of see how the baby's moving. So that's the general musculoskeletal exam that we do.
Okay. And everything appeared to be normal from that visit?
It did.
Okay. Is it your policy in your office to schedule the next appointment before they leave? Would you schedule in
is.
advance?
Uh-huh.
Okay. And so when was the next time they were supposed to return?
Let me see. You asked to follow up at the 2 months and 6 to 8 weeks.
I just don't like them being on screen, y'all. Sorry.
Let's see. So I'm not sure, I don't see a date on this that actually,
Let me refer you, I believe, towards the front of your chart.
okay,
You
that's good.
provided a document to our office that's labeled future appointments.
Okay,
I think there's 2 of them there.
Yes.
Okay, and so do you see one that looks like the
Yes,
one that I
says
have?
March 21st, February 7th and March.
If you'll go to the next page,
Okay,
sorry.
that's okay.
And then what is the earliest date there?
February the 21st.
Okay, and does that, I'm sorry, the sheet you're holding there match the sheet I'm holding?
It does.
Okay. And from your records, doctor, did they appear on February 21st with baby Dylan?
They did.
Okay. If you'll refer to that part of the chart. Again, what's the purpose of that visit?
Well, I think we wanted them to come back a little bit sooner because of usually they come back at 2 months. So this was a little earlier than 2 months. It's about almost 6 weeks. But one of the concerns, I guess, of course, was the abnormal newborn screen. Again, when we sent him to the lab, they did part of the lab work that we ordered, but there was an error made at the hospital, somewhere in the lab or registration, I'm not sure where.
Color
They
me
didn't do
surprised.
The second part of the test that we ordered. So we had the electrolytes that came back that were normal. That's the sodium and potassium in the blood, which were normal, very reassuring that he did not have the condition that the newborn screen indicated that he might have. But there was another test that I was looking for that was not done. That was a repeat of the newborn screen, and so they
Okay.
didn't do that.
Let me ask you, are these follow-up screenings that you're requesting in regards to the abnormal screening that showed that he may have abnormal or elevated levels of 17-hydroxyprogesterone?
Yes,
Okay. At some point, was that eliminated?
it was eliminated because you have to understand that I was not the physician that took care of the child in the hospital at Southern Ohio Medical Center. So they came to me subsequent to that. And I didn't realize that they had done a 17-hydroxyprogesterone at the hospital before he ever left. So with his normal serum electrolytes that were done on the 7th of February, coupled with the normal 17-hydroxyprogesterone level that was done while he was in the hospital, that pretty much eliminates the risk for him having that condition, 21-hydroxylase deficiency or congenital adrenal hyperplasia. So he did not have that, but I didn't realize that. So that was why I didn't realize he had
Oh
it.
no, we're backinating. God, blessed be the closed captionings because they give us genital Brianda hyperplasia. For the love of congenital.
Hyperplasia. So he did not have that, but I didn't realize that. So that was why I didn't realize he had that other test done. So that was one of the reasons I kept
You
trying
kept asking the parents to
asking the
take him.
parents to do that.
Did they take him, to your knowledge?
The second time, they took him the first time, but I don't know. We never were able to get the repeat newborn screening done. They didn't go back,
Okay.
is my
And we'll-
understanding.
We'll come back to that in just a second. So let me direct your attention back to this February 21st office visit. Who presented there at the office with the baby?
I believe it was mom and dad.
Okay. And again, if you would, tell the members of the jury what his height and weight was at that visit.
Yes, his weight was 17 pounds, 7 pounds, 15 ounces, although it says 7 pounds, 16 ounces. I don't know how that happened, but it's 7 pounds, 15 ounces when I went back and looked. But, and his length was 20.3 inches.
Okay. And if we reflect back to the future appointment sheet that we just looked at, and the one before that, what were the next scheduled appointments for baby Dylan?
So March the 7th, I'm sorry, and, which would have been 2 weeks after this one, and then, May the 2nd.
Okay. And would it be fair to say that March the 7th was probably because you'd asked him to go again to get more testing?
I think that was part of it. Part of it was too, that his weight percentile was on the lower end of normal. And so I wanted to make sure that he continued to gain at a normal rate.
So he was gaining, but not
Aw.
as much as you'd like?
Not quite as much as I would like,
Okay.
but he started out with a low birth weight. So it was okay. I just want to make sure it continued to be okay.
Okay. And correct me,
The youngest, most feral was like that. He had a lot more appointments because he was just, as per usual, trying to be dramatic. And God love him, he just he's just not going to be a real hefty guy. He's just a little skinny kid. So that's just how he's built. But he's, on the right percentile for his arc, if you will. But it's it's not really the highest percentile.
Correct me if I'm wrong, you did not ever see baby Dylan again after that, is that right?
I did not.
During that February 21st exam, do you again perform that musculoskeletal examination that you demonstrated here for the jury about moving all the body parts and feeling him all over?
Yes.
No indication that he was injured at that time?
No.
And it looks like from the records you provided, your staff was attempting to contact the parents, but not getting a response.
Yes, I don't think we ever made contact. I think by phone. I think we sent a letter that we did not hear back from.
Okay.
How is this pediatrician more emotionally affected than the parents? And I know the parents have cried or made sad faces, but you can tell this pediatrician really cares about his patients, and I don't think he expected or he hoped that he would never have to be called to testify in a trial like this. I mean, this has to be heartbreaking for everyone involved except the parents. The parents seem to just be upset that they got caught. And, I am in full petty mode. I dislike the incubator and the dingus. So, but you can tell this bothers him. And it's sad that it doesn't seem to bother the parents as much other than them getting caught.
Let me ask you to refer towards the end of your chart there and see if you can locate these two documents in your records.
I do have them sped up to 1.25, so they are not actually herky-jerky in real life. They're just
I have a difficult time finding them as well.
Yes,
Okay, and are those the same documents that I'm holding?
they are.
Okay, and so in referring to that exhibit, would it be fair to say that your office sent a letter to the parents on February 26, 2019?
Yes.
Okay, and what was that letter in reference to?
It was in reference to the laboratory, abnormal state lab,
Okay, and so you're asking the parents,
to contact us. And it also says, so please give our office a call concerning the lab work that must be completed for Dillon, the state, and that's talking about the state of Ohio and their laboratory system. Those people have reached out to us about this repeat newborn screening. If the test is not repeated, they will involve Children's Protective Services. I'm sorry if this has caused any inconvenience for you, but this must be repeated, talking about the newborn screening.
okay, and then there's also a letter sent from your office on April 1st, is that right?
Yes.
Okay, and what's that letter in reference to?
It says, it is very important that you call our office, and it provides the number 606-932-2079. Please ask for Anita Jacobs.
Okay, and your office was continuing to call by phone and not getting a
Yeah,
response
I
at that
can't
time?
tell you exactly how many times, or I don't have those
Okay.
times actually for you.
All right, if you would explain to the members of the jury, what is the mobility of a baby approximately 2 to 3 months old?
Well, they pretty much stay where you put them. You know, they move their arms and legs.
okay, y'all. I know I'm stopping a little much, and this is probably more Mo kid talk time than normal, but I call this the lumpy potato stage. I love the lumpy potato stage. It is always good because you can set them down in a safe place always where they're not going to fall, but they stay there. They stay there. You can move around unless you have older children that will move them. But I love the lumpy potato stage. The lumpy potato stage is my kinda jam. It's that two-year-old into everything whole thing of baby powder thing that I'm a bit okay with, not doing anymore until grandchildren. I think we are done with the baby train considering both Mo and I have or both Mr. Mo and I have been fixed.
Legs, they usually start cooing and smiling around 2 months, but they're not really able to roll over consistently. They can't crawl, so they really don't have the ability to go anywhere other than just kind of where you put them.
Okay. And is a baby of that age capable of inflicting serious physical harm upon himself?
I don't see how they could.
Okay. Have you ever seen a 2 or 3 month old baby in your 30 years of practice that's caused a skull fracture to himself,
No.
caused a rib fracture to himself?
Okay, so they are going to start getting into some of the injuries. Uh, let me see, I will timestamp this on my uh, description because, eh, I'm trying to put parts of the video that I know might be really upsetting. Uh, so I've written down the time when it starts, so I will also write down the time that it ends. But what I wanna say is that the Groves story originally was that baby Dylan pulled a dream catcher, which is why I have a dream catcher on there, on himself, and that gave him all of the injuries that you're going to hear about.
No.
Caused an arm fracture,
No.
a leg fracture?
No.
Okay.
Okay. Sorry, I just need to get those timestamps, so if you guys don't wanna hear about that, you guys can, of course, skip right on over. I never ever want anyone to put their mental health in harm because, I want views or anything that is so far down the list of priorities. You take care of yourself.
What type of reaction would in your experience of 30 years, would a baby have if they have some serious injury like that? How do they react?
Well, you talking about bone fractures, like
Yeah.
leg fracture, femur fractures?
Yes.
Yeah, they would be in a lot of pain, just like any of us would be. They feel pain just like we feel pain.
And how do
so
babies exhibit symptoms
they
of pain?
cry. They oftentimes they don't feed well. It's evident whenever you move them that they're in pain. I mean, when I simply examine the hips, sometimes in stretching those ligaments of the hips, I can see those babies. It hurts a little bit, and they let you know it. They cry. Mostly they cry. They'll let out screams, but they let you know when they're hurt. And fractures hurt.
Okay. What kind of symptom or sign would you expect to see if there was a fracture in your experience? In other words, how would a parent recognize the baby has a fracture? What would we be looking for?
Well, it depends on the type of fracture. If you have a fracture of, say, a long bone, say humerus or femur or tibia, the long bones, if it's completely broken in two, what we call a transverse fracture, then usually you could see that the leg or the arm is crooked. It's not normal compared to the other one. Oftentimes there's swelling, but there's always pain.
Okay. What about skull fractures?
Skull fractures are often associated with bruising, but not always. But again, they're painful.
Would there be swelling associated possibly?
Usually, but not always, but usually, yes, there would be.
Okay. Could a skull fracture result in a brain bleed?
Yes.
If I could have just a second.
I super de duper hate you both. Like, just full stop, don't like you, point
Are there any
blank.
further questions at this time?
Okay, I just wanna get those timestamps up, so I will have 2 different timestamps in the description, if I can do this with my ADHD and dyslexic brain, that's why I'm always so shocked I can say numbers on Newsy News.
Stratton, you may cross-examine the witness.
Thank you, Your Honor. Good afternoon, Dr. Hudson.
Definitely.
Just a few questions here. You saw Jessica Groves and Dylan and Daniel Groves in your office twice, correct?
Yes.
Okay. Either visit, what was your observations of the demeanor of the parents?
You know, there really wasn't anything that stood out in my mind.
Okay.
You know, really, the only thing I would say is one of the things that I like to do is I like to have just a word of prayer. God bless the baby. And usually, they just, you know, the only thing I would say is when I got done praying, they just kind of looked at me a little differently than what I'm used to. That's all. But I didn't make anything out of it
Okay.
at all. That was the only thing I would say that was a little bit different.
That's because they were demons, sweetheart, and you were trying to bring Jesus in there, and they were afraid they were gonna get struck by lightning.
About the visit. That's it.
So they asked the appropriate questions, answered the appropriate questions?
You don't remember specifically questions they ask,
Okay.
but you know, parents are all different.
Right.
Some come in and they've had experience and they don't have a lot of questions.
Yeah.
So I don't interpret them by not asking questions to think that, you know, there's something up or they're bad parents.
Okay.
Other parents keep me in there a long time asking a lot of
Yes,
questions.
yes. But there was nothing strange
Nothing
about
that
this?
struck you out, yeah, other than what I told you, nothing at all.
Okay. You mentioned, that typically a baby at this age, if he had some of the injuries that the prosecution had mentioned, that there would be pain involved.
Like broken bones and
Yes.
full fractures.
Right.
Yes, yes.
If a baby was in pain like that, the baby would scream, be crying,
Yes.
okay? Would the baby be screaming and crying if the baby was under the influence of a drug or a substance, like a narcotic? Felix's arm was broken, but it was given or had drugs in his system. Would this baby be crying?
I would think so, you know, unless they were given like medically high doses of some kind of narcotic, like, you know, if they're in the hospital, the intensive care unit, and you have to give them medication like that to sedate them. But those kind of medications are very sedating. So if you have high enough levels to suppress, I think, the pain from a broken bone, typically you're going to have a baby that's almost obtunded or going to be very, very sleepy and not waking up and not eating and wouldn't be acting normally when you see them.
What about illegal substances? If a baby had illegal substances in his system,
Can you
Could that-
specify a legal substance you're talking
like,
about?
let's say methamphetamines, amphetamine,
That's not a pain killer.
okay? So none
no,
of that?
That would not in any way alleviate pain.
Okay. When you talk about fractures to the skull, you said that there's not always bruising and swelling associated with those?
Not invariably, usually, but not always.
Not always, okay. No further questions, Your Honor.
Thank you, Mr. Stratton. Ms. Scott, you may cross-examine the witness.
Thank you, Your Honor.
Good afternoon.
Do you recall if you also treated the Groves' older child, Daniel Groves Jr. or not?
I know Daniel's been in the office, but I don't remember the last time that I saw him.
But this family has a prior relationship with you outside of Dylan Groves. They had their other
They
child in
have
your
been
office.
in the office with Daniel. Daniel was actually, I think he was in that day, according to records. I did look at that before I came in. I just don't remember that interaction. But yes, I did. It is in our records that I saw Daniel the day of the first visit of Dylan to the office.
So on February 7th of 2019, you would have had a visit with both Daniel Jr. and Dylan at
Yes.
the same time. Okay, so
In
this
different
family,
rooms, though. They weren't together.
sure, sure. Well, one's probably 13, 14 at the time, and then you have an infant baby. So, okay, I get you. But this family had a prior relationship with you, correct?
Yes.
Okay, so you've had multiple times to observe them.
I just can't, you know, I would have to go back and look. So I can't really comment to that as far as observing him over multiple times. I'm sorry. Again, it's just one of those things I see
No,
a lot of
that's-
patients that don't remember.
That's okay. I almost feel like you're thinking I'm going to ask you a trick question. It's not a trick question. I just,
Right.
I'm
I
just-
guess what I'm saying, but I want to answer truthfully. So
Sure.
I even going back and looking at the times that Daniel's been in the office, there wasn't a lot. I think that in our records that we've had for the past almost 3 years now, I think there was only a couple of visits. One of them was from February the 7th. And then he may have been out in our Lucasville office where we had a different medical record. And so I didn't go back and look at that to see how many times he'd been out there and if I'd seen him there.
okay. But did anything that you did review or look at give you any suspicion
when baby Dylan was brought in, that these parents were not going to be compliant with what you asked them to do.
No, I thought they would be compliant with what I
Okay,
asked.
great. And as far as you know,
Survey
they
says
went over
that is
there and
false.
attempted to perform that lab test, and there was some kind of error, and
Yeah, they went as I asked them to do.
Okay.
And they did, that first time, they did exactly what I requested them to do. And the mistake was made on the hospital's part.
the hospital made the mistake, correct?
Yes,
Okay.
but it was the follow-up that we were unable to get them to go back.
Okay.
I-
And I believe that you already stated that you didn't see anything odd or out of the way, other than at the conclusion of this one prayer, you thought they kind of looked at you funny.
Yeah, that's the only thing. And I wouldn't even bring it up except I was asked and I swore
Okay.
I would tell everything.
But they know that that's kind of a practice that you have with your patients, that sometimes you say prayers with your patients at
Yes,
the
it
end.
is.
Okay, so that wasn't unusual.
No, and they didn't object because I asked them beforehand. I'll just break
Sure,
down into a prayer.
sure. I mean, yeah, and that's a practice in your doctor's office, but they didn't, it was just a look.
That's
And-
all.
Excuse me?
That's all.
And they didn't say anything out of the way.
No, they did not.
They didn't negate anything you said,
Might have
or,
been just surprised. I don't know.
Okay.
But it wasn't anything
okay,
mean or unkind.
okay. And I know that you were addressed or asked to address the issue of a potential skull fracture. Do you know how long it takes for a small skull fracture to heal or show signs of
I
healing?
think you should be able to see some signs of healing within a couple of weeks on a re-X-ray, I think.
Okay. And the pain and the bruising that you talked about with broken bones or skull fracture, would that subside over somewhat of a period of time once that healing began?
Yeah, it takes, of course, younger babies heal quicker. Typically, you think about 6 weeks for like a long bone fracture, humerus or radius ulmus, femur, tibia to heal.
Right.
So you would expect there would be some tenderness or some abnormality that you could see, depending on the severity of the fracture.
Right.
If it was completely broken in two, you should be able to see that, a swelling, even weeks later.
But if we're talking about a skull fracture
Uh-huh.
that is not very long in length, maybe less than 2 inches,
Yeah, it
that
depends.
was
If
not
it's
like a crushing,
Yeah,
not
if
a
it's a
crushing injury.
non-depressed skull fracture, a simple skull fracture.
I want to call it a clean break, but maybe associated, like, I don't even, like,
As far as, so you're saying, what are you asking me? I'm sorry.
like if the length of it, it's not a crushing skull injury,
Uh-huh.
there's not an indentation of the bone.
Okay, I find this so gross that she is trying to downplay the fact that he had multiple skull fractures. And she's like, well, look, the first one was an itty bitty one at just less than 2 inches. I understand she's a defense attorney and she's trying to work zealously for her client. And, that is part of our justice system, but it just makes me want to punch a pillow, if you know what I mean.
Not depressed.
It's
skull fracture.
merely a line
Uh-huh.
fracture, and obviously I'm not a medical person, so I'm not sure what the terminology is. How long would that take to start showing signs of healing, if you are aware?
Well, I guess I can't say for sure. To show signs, you mean like when you say signs of healing, you're saying.
That the bone
you
was
could
starting to
actually
knit back together?
That you could X-ray and see that there was healing?
That's correct.
Okay. You might see some signs on X-ray in just a few days,
Okay,
but it may take long. But
Right.
I'm really not, I don't feel like I know enough about that to comment definitively. I mean, I know what I've read and usually within a few days, but
Okay.
that's not something I follow.
okay. And then any bruising or possible swelling that would be associated with that, would that go away after a few days as well?
It depends, again, on how much tissue damage there was at the time of the skull fracture. Sometimes there can be skull fractures, babies can fall out of grocery carts and not even have a bruise. So to say that the bruising will be gone in a few days is kind of a difficult question to answer. But I think if there's a lot of trauma to the subcutaneous tissue, then you could be a parent there for 2 weeks later, you could still see bruising. Because bruising is simply blood that from the trauma that gets underneath the skin, and as that blood is reabsorbed, it goes from being kind of a dark purple to a reddish to a kind of a brown, yellow, and then it is gone.
So let's use your example that you just gave, that if a baby fell out of a shopping cart and caused a skull fracture,
Mhm.
that would not be like a crushing injury,
It
correct?
could be, it depends on
But-
how, depends on how far they
Depends on
fell,
how the
and what
baby
they
lands.
landed on.
Right.
There have been some really serious injuries, although children have fallen from that height.
But you use the example that sometimes you may not even see anything associated
Sometimes there
with
may
that.
not be much
Right.
of an external evidence of a skull fracture other than an X-ray, which is of course not external.
Right.
As far as just examination with your eyes and hands, you may not be able to detect it.
But that's what I was getting at. So there may be some incidents that would result in a skull fracture that may show no outward signs, such as bruising or swelling.
That can happen.
Thank you. That's what I needed to know. Thank you so much, Dr. Hudson. I appreciate it.
Any further questions, Ms. Scott?
No, Your Honor, thank you.
May we direct?
Doctor, you were asked about suspicion that they would not be compliant. And you
Mhm.
said in February, early February, you had no suspicion that they would not be compliant. And in fact, on February 7th, they did comply with your request.
Yes.
Okay. But thereafter, they did not. February 21st, they did not.
No.
And then
I
they,
did explain to them, from my perspective, why this was so important.
okay. And then they failed to show up for future appointments and failed to have contact with your office after that.
Yes.
Okay. You were asked about whether a baby would exhibit signs of pain if he were on illicit substances or prescription drugs, but the topic came up of methamphetamine, and you said that's not a pain medicine.
Yes.
What does methamphetamine do to the body?
What does methamphetamine?
Yeah, what effect does it have on an infant's body if a baby's exposed to a methamphetamine?
Well, you would expect the baby, amphetamines are stimulants, okay? So you would expect the baby to be crying a lot. What do babies do? You get overstimulated, you expect them to cry a lot, you expect them to not sleep. If they were under, influence of methamphetamine, maybe not to eat well, maybe to vomit, but sleeping and not experiencing pain, I wouldn't think would be a side effect.
As a pediatrician, do you chart the circumference of a baby's skull or head?
Yes.
If you would tell the members of the jury what the circumference of that baby's head was on February 21st.
Six centimeters.
Okay. And I'm a lawyer for a reason. How many inches would that be?
Well,
Do you
divide
know?
that by 2.54. So you're talking roughly around maybe 14.
I apologize, doctor.
That's okay.
But if you know,
Well, I'd have to, so you did 36.8 divided by 2.54. Someone want to do that real quick? I can't do that on my head.
the judge has a calculator for you.
Okay, thank you.
Thank you, Your Honor.
All right, appreciate that.
Your Honor, for the save. No one can do mathing.
There we go.
Oh, not the crotch shot. Thank you, Law and Crime. Although, no thank you, Law and Crime. But he's married and we don't
14.5 inches.
Okay. and
We
how
don't
is that measured,
disrespect
if you
other
would
women.
Explain that to the jury.
We have a tape measure that fits around the head. And so you wrap it around and you just read the number.
Okay. So if baby Dylan had a 2-inch skull fracture, that wouldn't be considered a little skull fracture. If his whole head is 14 inches around.
No, I would think 2 inches. 2 inches is a significant skull fracture. Yeah.
It's a
So
1-inch skull
any
fracture.
fracture is significant. Absolutely.
I have nothing further, Your Honor.
Any recross, Mr. Stratton?
No, Your Honor.
Ms. Scott?
Your Honor, if I have a second.
You may.
Okay, is he ordering his appetizers or asking for a break? You two don't get much sympathy. But this is where I'm going to pause it because their next witness will be Andrea Bowling, Dylan's foster mom. And that one will definitely be emotional. Like I said, this Miss Bowling was really the only tender love and care that this child got unconditionally without being with incubator and dingus. So, have your tissues ready. And again, no shame at all whatsoever. If you guys need to skip the, the foster mother and the medical examiner, because I think those are the two that are coming up next. And or whenever they come up, I will put the medical examiner in her own video just because I know that some people can't handle that, and I totally, totally get it. So I will see you guys in a little bit. Thanks for joining me through this trial. I know it's not an easy one. No one likes to hear about kids getting hurt or unalived, but I do think that this prosecutor is going to really show just how she feels about it, and I'm okay with that. So I will see you guys in a little bit. I am going to put those timestamps down in my description. So if you don't want to see them, or don't wanna listen to, the parts where this pediatrician talks about injuries, hopefully I got them accurate enough that you will not be, having to listen to that. So have a wonderful day wherever and whenever you are. Say something kind to yourself, say something kind to someone else. Let's spread some kindness around for baby Dylan. Thank you guys and have a lovely day. Bye.